Welcome to this Respecting Choices webinar on teaching and presentation strategies. My name is Linda Briggs. I am the Director of Program Development and Research for Respecting Choices. In all of our Respecting Choices programs, we emphasize the key role that instructors have in promoting a robust classroom experience, an experience that stimulates critical thinking and experiential learning. Rather than a sage on stage, these strategies will help you create an atmosphere of guide by their side. It will be important for you to reflect on your current teaching style. What kind of a teacher are you? We will often teach as we've been taught, adopting behaviors of perceived experts. We will ask you to be open to learning new teaching strategies to integrate into your own style and observe the impact they can have on participants' critical thinking skills. When team teaching, we'll ask you to ask for feedback on each other's teaching strategies for ongoing improvement. The objectives for this webinar are to identify and discuss 7 teaching and/or presentation strategies to promote critical thinking and classroom learning. And we'll also ask you to create a personal plan to improve your own teaching and presentation strategies. These are the 7 teaching and presentation strategies we will review in this webinar. Instructors have the opportunity to role model general interview skills. In addition, storytelling, critical thinking, values clarification, conflict resolution, competency assessment, and team teaching strategies will be discussed. These are the general interview skills and techniques that are a core component of all Respecting Choices curriculum. As instructors, you have the opportunity to role model these skills in the classroom setting. This role modeling reinforces learning and demonstrates the power and effectiveness of these general interview skills. Let's look at a few examples of how you can demonstrate these skills as an instructor. Listen to participants' questions. For example, instead of automatically responding, explore the meaning of their words and phrases. Explore them and clarify participant statements. For example, I hear you've been frustrated with these conversations. Tell us more. Use anything else as an effective role modeling strategy to explore participants' learning after each role play exercise and after the video examples. Listen for themes. Acknowledge the common themes that arise in the classroom setting. For example, the time it takes to have quality conversations, or patients' fears about their medical condition. Take opportunities to affirm and reaffirm the purpose of these conversations, and also verbalize empathy for the participants who are often learning these skills for the first time. These conversations can be challenging. This slide reviews the 3 additional general interview techniques of teach back, remaining value neutral, and paying attention to nonverbal communication. As instructors, you can take opportunities to demonstrate the teach back strategy in the classroom setting, for example, when providing information about CPR. Remember to remain value neutral when telling stories, giving examples, or answering questions. Remind participants to look for these skills during video examples and role play activities. Together, they can help each other work on their skills during the classroom experience. The next technique is storytelling. It's a powerful technique that promotes learning from real-world experiences, develops reflection and new perspectives, describes thoughts and feelings, and encourages critical thinking, considering multiple perspectives. However, there are some important potential disadvantages of storytelling. Let's review a few of them. A story that does not relate to the agenda may be interesting, but will not reinforce learning objectives. A story that is long and rambling may lose the attention of the audience. A story that communicates personal bias and values may inadvertently give permission for others to communicate their own biases. And a story that reveals confidential information. On this slide, we offer a variety of strategies for preparing for storytelling in the classroom curriculum. Select stories that relate to the agenda or the theme of the discussion. Be brief and succinct when telling a story. Prepare and practice the stories. Avoid verbal or nonverbal communication that may be value-laden. Frame the story. For example, what is the theme you want participants to listen for as you tell the story? And always, for group learning, summarize the story. As a team of instructors, you may want to coordinate the type of stories that you're going to tell. You're going to want to understand each other's stories and their relevance to the agenda. Critical thinking is another teaching and presentation strategy. A popular definition of critical thinking from the literature is, quote, thinking about your thinking so as to improve your thinking. Critical thinking is not about always having the right answer. Critical thinking promotes a careful examination of ourselves and others. It promotes collective thinking, helping participants learn from each other's perspectives. It promotes a willingness to question ourselves and others, an ability to challenge our assumptions, and it requires active listening. We use a variety of critical thinking strategies in our Respecting Choices curriculum, and I'll review many of them. Number one, provide more questions than answers. As an instructor, you don't always have to have a quick response to a participant's question. Instead, you might engage other participants in thinking about what they would do or what they would say. Clearly, it's important to role model your own critical thinking behavior. For example, an instructor could say, "I've never thought about that question. Thank you for bringing it up." That will show your interest in expanding your own thinking. Instructors can summarize questions and themes for group learning and reflect questions back to the group. One of the challenges of any curriculum is adhering to the core content and staying on track. Instructors who know the agenda roadmap will be able to defer questions that apply to a future agenda topic. Another critical thinking strategy is to acknowledge content that falls outside of the scope of the course but is useful for follow-up. Examples of such content could include participants' questions about the assessment of decision-making capacity or guardianship laws in your state or organizational documentation expectations. Additional critical thinking strategies include the expectation of participants to come prepared. The small and large group discussion is another critical thinking strategy. For example, people break into small groups to do the role play exercises, but then come back together for large group discussion. Storytelling and values clarification, as well as analyzing common problems and encouraging different points of view. There are times in the classroom that I have simply said to participants, "I feel the tension in the room. Thank you for sharing so many different perspectives. I hope you all continue to think about these issues." Values clarification, another critical and important teaching strategy that needs to be integrated into the classroom curriculum. Shared decision-making conversations can be challenging for many reasons. Personal values and biases can be communicated to individuals and your participants in many ways, both intentionally perhaps or even unintentionally. As instructors, we ask you to please think about the consequence of value-laden communication. For example, if you communicate your biases, it may give permission for participants to do the same. Again, role modeling skills and behaviors sends important messages to participants. Values clarification strategies used in the classroom first begin by examining your own values and biases. Become aware of what your hotspots are. And then, as an instructor, being observant for value-laden remarks that might crop up in the classroom setting. Explore value-laden statements as opportunities for critical thinking and group demonstration. For example, what if a participant says to you, "I'm frustrated with the way patients make bad decisions"? As an instructor, you might say, "It sounds like you have had experiences with patients making decisions that you did not agree with. What do the rest of you think about these situations?" Or you might also explore the person's meaning of bad decisions. Continue to emphasize the role of the individual that you're interacting with in promoting person-centered decisions by remaining value neutral. The next teaching and presentation strategy is the concept of conflict resolution. These conversations clearly raise the potential for classroom conflict, which include religious, spiritual, cultural, or personal beliefs of the participants in your classes, the concern that they might have for the delivery of futile or non-beneficial treatment, their practices with informed consent, their experiences with the use of coercion or manipulation in soliciting treatment preferences, as well as their varying background, experience, and skill. These issues may be impacted by recent events that have occurred in the organization, patient situations or experiences, and/or organizational practices. Strategies to resolve such classroom conflict are many. We encourage you to think about what strategies you may have used in the past. But first of all, maintain composure. This may require really understanding what your own hot spots are so that you can monitor your own reaction. You are a role model for how conflict will be resolved. Ask more questions and explore the meaning of the conflict. Listen actively. Promote healthy discussion. Pay attention to nonverbal cues. Invite other participants to participate and decide when to agree to disagree. We encourage you to avoid engaging in personal, one-on-one debate in the classroom setting. Remember, your role as an instructor is to promote group learning. Individual conflicts and struggles certainly do occur, and we encourage you to handle those by meeting with the individual at breaks or at the end of the class. The next teaching and presentation strategy is the concept of competency assessment. Competency includes more than simply knowledge. It is the ability to perform a set of skills within real-world situations. It requires the ability to define a set of skills and then figure out if you're actually meeting the expectation of those skills. And it requires a varied set of skills, and clearly the importance of practice can't be underestimated. The competency assessment strategies in this curriculum include our use of interview tools to clearly define the interview skills for beginning competency. We emphasize that knowledge is important, but also practice will improve the competency of any individual as they learn new skills. We provide the opportunities to practice skills in the classroom setting. Through years of the Respecting Choices approach to integrating role-play exercises into the curriculum, we've heard from participants that it is one of the most valuable and powerful components of the classroom experience, even though they may have resisted wanting to participate. Providing real-time feedback on achievement of defined skills. Instructors observe role plays and give immediate feedback using competency skills checklists. Respecting Choices recommends that you consider not awarding certification at the end of a classroom course. There are many individuals who will need more practice and mentoring to effectively integrate these new skills into their practice. The instructor team can develop follow-up activities as needed to address both individual and group learning needs. Once competency is effectively demonstrated and validated, certification then can be awarded. The last teaching and presentation strategy is the value of team teaching. We advocate a team approach to the delivery of the curriculum for many reasons. First of all, individual instructors bring a variety of experiences, perspectives, and knowledge that promote a robust learning environment. Instructors can be assigned to agenda items that match their expertise and background. Multiple instructors can be used to facilitate the role-play observation and real-time feedback. And multiple instructors can be used to support participants' questions, promoting critical thinking, and addressing participant needs and concerns. Team teaching, however, can be challenging and requires coordination, communication, and ongoing improvement. Instructors need to negotiate the agenda assignments to match their skills and experience. They need to review and understand the related instructor guidelines provided by Respecting Choices. They also need to understand the course content, so questions can be deferred for a later agenda item as needed. Instructors need to adhere to the agenda timeframes in order to respect the other agenda items as well as the other instructors' time. Instructors can provide continuity of content, listening to the themes and examples that are presented during the classroom curriculum, add content rather than repeat content. It's important that the team of instructors don't leave the room during the classroom curriculum. Their presence will help them stay connected with the concerns of the participants and promote instructor teamwork. Instructors can also check in at breaks for concerns about participant questions or themes that they don't believe have been adequately addressed. And importantly, instructors need to debrief that, and we recommend that happen at the end of the day so that you can share your learning and suggested improvements. In summary, I hope these teaching and presentation strategies will be helpful to you in your role as instructor. I encourage you to create a personal plan to identify a few initial strategies to integrate into your own teaching style and assess their effectiveness. Thank you for your ongoing commitment to providing a quality classroom experience.